The views and opinions expressed on America's Workforce Union podcast and its digital media channels are solely those of the speakers and do not necessarily represent the views and opinions of the producers or sponsors.
Welcome to the America's Workforce Radio Podcast, the flagship production of the American Workers Radio and Podcast Network, where organized labor and its never-ending fight to protect the rights of the American worker come first. Now, presented by LIUNA, Laborers International Union of North America. Here's your host, Ed Flash Ferentz.
A one-day strike by nurses in Massachusetts ends up in a lockout. Meanwhile, the landmark ruling by the U.S. Supreme Court on executive authority. And today on the show, why we need to expand Medicare. Medicare for all. Welcome to the Monday, July 13th edition of America's Workforce, where we're available on at least 5 platforms, including YouTube, Apple Podcasts, iHeartRadio, Spotify, and Pandora. It is safe to say that the healthcare system in America is not very good. And I'll tell you, today, we have 2 guests that want to change it. Medicare for all. Jamie Brown is one of 4 presidents of National Nurses United. Jamie is going to be joined by Jasmine Ruddy. Jasmine is the director for the Nurses Medicare for All campaign. And let me drive you to the website. It's Medicare, the number 4, all.org. Medicare4all.org. Well, recently, National Nurses United and over 300 organizations, including a lot of labor unions, plus advocates for seniors, people with disabilities, women's rights organizations, they all released an open letter making the case that now is the time for Medicare for all. Right now, Medicare for all is very, very popular, overwhelmingly popular, and commands majority support nationwide with 63% of all voters in favor, including 90% of Democratic voters. In Congress, more than half of the House Democratic caucus now supports Medicare for all, and Senate legislation has added 3 co-sponsors since the last Congress. So we're going to get into all of this because this is an opportunity. Right now, there are millions of people that cannot afford the health care that America is providing. That's why we need Medicare for all. So our featured guests on the show today both come from National Nurses United. Jamie Brown and Jasmine Ruddy will be joining us as our featured guests. Now, a brief look into the world of labor. This segment brought to you by Boyd Watterson Asset Management. We're talking $38 billion of assets under advisement, serving the needs of Taft-Hartley funds, corporations, public funds, endowments, foundations, and even religious organizations. BoydWatterson.com is the website you want to go to. Speaking of nurses, after a one-day strike, this was Wednesday, July 8th, Brigham and Women's Hospital has locked out over 4,000 nurses organized with the Massachusetts Nurses Association. Now, in mid-June, over 99% of the nurses voted to authorize a strike, the largest such vote in the history of that state. The strike was also the largest such strike in Massachusetts history. Nurses' demands center on wages and health care costs. To maintain service, the hospital signed a 5-day contract for temporary replacement workers, in other words, scabs. In a tense moment on the morning of July 9th, a large crowd of striking nurses approached the hospital's front doors and announced that they would like to return to work. Well, at the door, guarded by police and security officers, a hospital rep informed the crowd that they would not be returning to work and were being locked out. Again, we're talking 4,000 nurses. It seems both parties anticipated such a lockout, with the union announcing on July 6th that both strike and lockout were on Brigham's board billionaires. The lockout lasted for the 4 days that remain in the hospital's contract with temporary replacement. So they're back there, but what they had to go through. In a landmark decision at the end of June, the Supreme Court ruled that President Trump has the power to fire a Democratic member of the Federal Trade Commission, the FTC, despite existing removal protections. This was a case they called Trump versus Slaughter, and it overturns 91 years of precedent, which had long insulated agency members from being fired at will by the president. The protections were designed to grant agency members a degree of independence, ensuring they could operate without fear of being replaced solely due to the whims of the president. John Roberts, Chief Justice, writing for the 6-3 majority, held that these limitations on the president's firing power are unconstitutional. Now, while the case concerned the FTC, the logic of the case would extend to essentially all independent agencies, and that includes the National Labor Relations Board and the Equal Employment Opportunity Commission. So the result will likely be rapid shifts in agency leadership with each new administration, as the president now has the complete power to replace the NLRB and EEOC membership to suit his or her political goals. Emily Dickens, the chief administrative officer at the Society for Human Resource Management, stated that these wholesale political changes to agency membership create greater uncertainty for both employers and workers, as the membership of these agencies can impact how workplace laws are interpreted and what issues will actually be enforced. So we will see what happens in the months ahead. All right, we're going to take a quick break. When we come back, two nurses on behalf of National Nurses United talking about why we need Medicare for all. Back in a few minutes. You're listening to America's Workforce.
You're listening to America's Workforce with Ed Flash Ferens.
It takes LIUNA to keep America running. Over 70,000 public employees are part of LIUNA, the Laborers International Union of North America, delivering critical services such as healthcare and emergency response, as well as maintaining roads and sanitation systems. Even the National Postal Mail Handlers Union, representing over 47,000 U.S. postal workers, is affiliated with LIUNA. Find out what it takes for LIUNA to keep America running at liuna.org. That's liuna.org.
America's Workforce is brought to you in part by the United Steelworkers. You can find more at usw.org. This segment of the show is brought to you by the Brotherhood of Maintenance of Way Employees Division of the International Brotherhood of Teamsters. For more information, please visit bmwe.org. The Heat and Frost Insulators and Allied Workers are proud to be a title sponsor for America's Workforce Radio. The Insulators Union is leading the way in the mechanical insulation industry, fire stopping, and infectious disease control. Regarded as North America's energy conservation specialists, these professionals are known for their professional work and dedication. You can learn more about the Insulators Union at insulators.org. America's Workforce is brought to you in part by the Communication Workers of America. You can find more at cwa-union.org. America's Workforce is presented by the Laborers International Union of North America. Feel the power right now at liuna.org.
America's Workforce appreciates our sponsor, the Columbus Central Ohio Building and Construction Trades Council, who represents more than 18,000 workers from 19 affiliated local unions and district councils.
Now, back to America's Workforce. Here's Ed Flash Ferens.
And remember, you can check us out on Facebook or follow us on X, formerly known as Twitter. That would be AWF Union Podcast, AWF Union Podcast. How many times have you heard the term Medicare for all? Well, if you're over 65, there's a good chance that you're on Medicare. And there's, different kind of Medicare plans. That's understandable. But what about the rest of the people? And healthcare is a big issue, especially when it comes to collective bargaining agreements. We have two guests on the show today. Jamie Brown is a president of National Nurses United. This is an organization that is growing. I've referenced many stories to them over the years here on America's Workforce. They're doing a great job. And Jasmine Ruddy is the director for Medicare for all. Jasmine, I'm going to start with you because I was reading recently that your union, National Nurses United, and over 325 organizations, and we're talking labor unions, advocates for seniors, those with disabilities, women's rights organizations, they all got together and released an open letter making the case that now is the time for Medicare for all. I love this story. Talk to me about it. I mean, you're in the middle of this whole thing. I want some more details on the letter, the work you put into it, and who hopefully is reading it. Let's start right there. Go ahead.
Awesome. Well, thanks so much for having us. And excited to talk about this, the letter and this ongoing campaign. We felt that this was such an important time to reaffirm national support across the country for Medicare for all and nothing less. And that's for a few reasons, right? Jamie will be able to speak more about this, but nurses have been fighting for Medicare for all for decades in the United States. We've always known that this is an important issue, but this moment in particular is important for a few reasons. First of all, as I think many of your listeners know, we're facing right now some of the most unprecedented healthcare cuts in the last year in history, right? $1 trillion cut from Medicaid and Medicare and the ACA last year. We're talking about somewhere between 10 to 16 million more people in the next few years that face being uninsured as a result of these healthcare cuts. So things are getting already bad and things are getting worse. But also, we know that right now, what's happening in Washington is that Democrats are starting to have that conversation about what can be accomplished in 2028 and 2029 if Democrats are to take back power in Congress and the White House. So that conversation about what next major healthcare reform the Democrats can coalesce around is starting now, and we wanted to be clear that with our message, and that 325 other organizations agree with, that we have that answer, and it's Medicare for all. That the Democrats, if they want to be bold and listen to voters and their constituents and push for the real true demand that's actually going to solve the root crisis of our healthcare system, they should support Medicare for all. And so that's really the kind of idea behind the letter. And as you mentioned, we're really proud to have now over 335 organizations signed on to this letter, including a number of labor unions, as well as, large national organizations like Indivisible and Move On. And we have sent the letter to every member of Congress. We've pushed it out, in the press. We're excited to be talking about it here with you today. We're going to be making visits on Capitol Hill, dropping off copies of the letter. We're hoping to do different informational sessions, hopefully a informal hearing of some kind in Washington. And we're also planning a national day of action later this summer, which I'm happy to talk about. But that's some of the idea behind the letter.
We're talking about a very popular idea here, overwhelmingly popular. Right now, from what I'm reading, 63% of all voters are in favor of Medicare for all, 90% of Democratic voters. So with that being said, I'm going to go to Jamie Brown. Jamie is president of National Nurses United. Like Jasmine's been saying, we've been talking about Medicare for all, and it's important that we strengthen Medicare for those that are on Medicare right now. I've had that conversation with a number of guests here on America's Workforce. So what are you hearing about the reaction of this letter so far? Jamie, I'm sure you're in the middle of it all. I'm sure some people are speaking out. There's probably on both sides of the aisle. What are you hearing?
I hear mostly positive about the letter. People are looking for a common sense solution, and healthcare is a human right. Medicare for all would take the burden away from the employer, and it would give us the right to change jobs without being tied to one employer and risk losing our healthcare and worrying about where we're going to get the medication for our kids. So it's a very popular idea from my feedback that I've been getting.
Would Jasmine reference what happened last year in the so-called Big Beautiful Bill? I mean, priorities were changed, and there was a mention of $1 trillion that kind of like disappeared from from Medicaid. I mean, that's just one thing. So the question deals with priorities. That's what I'm zeroing in on. It's not like we have to come up with new money. We just got to redirect the money that's already there. Is that what I'm hearing on this?
Yes, we absolutely need to redirect the money that's being taken out. We find the money for illegal wars. We're finding money for ridiculous construction in the White House and UFC fights. And somehow we were not able to find the money for Medicare for all. Healthcare is such an important issue to people. I see people coming into my hospital sicker and sicker because they are delaying the necessary medical care they need to get.
So right now, would you say that we're losing lives as a result of our healthcare system? I've heard stories like that. I'm sure you're closer to the situation than most, being the president of National Nurses United. I know some states didn't sign on when Obama created the healthcare system, the Affordable Care Act. Some states were kind of slow in starting up. And I noticed when they did some research on those states that there was a number of people that probably lost their lives as a result of the lack of health care in those various states. What do you know about that?
What I'm seeing is that, yes, people are absolutely losing their lives. By the time they finally come into the hospital, they are so sick that we are unable to save them anymore because they have put off the necessary care they needed. And it's disgusting that our country cannot prioritize everyone's health and that we are letting people die.
When you see that happening in hospitals, I'm sure you contact your local elected leaders to say, you know what, we've got a problem here. What are they telling you? What are they telling you? They said, well, we're trying to work on it and nothing's happening. There's got to be some kind of a response. And obviously, Medicare for All would help in this whole situation. Have they brought that up to you in your conversations with them?
The elected leaders I'm working with, well, my local or state elected leader told me Medicare for All was not the solution and that we would have to agree to disagree because he is not in favor of Medicare for All. But we're going to vote him out and get somebody that does support Medicare for All.
So right now, Medicare for All is not on the table. You're trying to put it on the table. Is there a timetable on this? Jasmine, let me go to you because you're the director of the Medicare for All campaign. You mentioned pretty much a PR campaign that you have in place. What is it, later this summer? Do you have a date on that? What's the plan right now to get the message out?
We're coming up in just about a month on the anniversary of the original passage of Medicare back in 1965. And so what we're doing this summer is really honoring that anniversary by calling for a national day of action across the country on July 30th. So we're asking folks across the country to host actions at the district offices of their members of Congress to really, kind of call on them to support Medicare for All and nothing less, to deliver a copy of this letter, among other materials supporting Medicare for All. And we're even going to have some fun, birthday elements to honor the birthday of Medicare, like balloons and cake, cards, things like that. So it should be a lot of fun. But we are aiming to have hundreds of actions take place on this day. We have a lot of interest and folks engaging so far, but anyone can sign up and can join the action nearest them by going to our website. It's Medicare for the number 4all.org. So Medicare4all.org with the number 4. Anyone can sign up to join the action nearest them or even host an action in their district on July 30th. And that's really, just the start of our plans this summer. Like I said, the debate around 2029 and what Democrats feel that they can accomplish starts now. And we believe that Democrats, should not, start with half of what we're asking for. Is, Jamie has said so well before and could speak more to. Nurses know better than anyone that we don't come to the bargaining table asking for half of what we need. We ask for the whole thing, right? And so our message to Democrats is, to ask for what we're demanding, to call for Medicare for all in 2029. And so really the organizing timeline is working up towards that and knowing that we have a lot of work to do between now and then. We think you have an opportunity. There's a real window to push for meaningful healthcare reform for the first time in a generation. It's been 15 years since the passage of the Affordable Care Act. We've spent 15 years. We would argue we've wasted 15 years, protecting, defending, and while that's helped us certainly make some important gains, we still have 25 million people in the country uninsured, another 10 to 16 million expected to become uninsured in the next few years. So this crisis is getting worse. Democrats have an opportunity, to pass real meaningful reform that's going to actually solve the root problems of our healthcare system. And Medicare for All is the popular solution. It's the moral solution. It's the right policy solution, and it's the right financial solution. So that's really our message.
We're talking about Medicare for All. We have two guests joining us from National Nurses United. The person you just heard, Jasmine Ruddy, she's the director for Medicare for All, and she's part of National Nurses United, along with Jamie Brown, who is one of the 4 presidents of National Nurses United. More to come. I want to talk about the specific unions. One of them, the UAW. The UAW has a history when it comes to health care. They push employer-sponsored health care decades ago. We'll talk more about Medicare for All right after this on America's Workforce. Don't go away.
You're listening to America's Workforce with Ed Flash Ferens.
It takes LIUNA to keep America running. Over 70,000 public employees are part of LIUNA, the Laborers International Union of North America, delivering critical services such as healthcare and emergency response, as well as maintaining roads and sanitation systems. Even the National Postal Mail Handlers Union, representing over 47,000 U.S. postal workers, is affiliated with LIUNA. Find out what it takes for LIUNA to keep America running at liuna.org. That's liuna.org.
America's Workforce is brought to you in part by the International Federation of Professional and Technical Engineers. You can find more at ifpte.org. America's Workforce is brought to you in part by the Ironworkers. You can find more at ironworkers.org. America's Workforce is brought to you in part by the Heat and Frost Insulators Labor Management Cooperative Trust. Find out more at insulators.org/LMCT.
There is unity and strength for workers.
We are the USW.
We are the USW.
The United Steelworkers.
The largest industrial union in North America.
We represent 850,000 members in the U.S., Canada, and the Caribbean.
We work in metals,
rubber,
chemicals,
paper,
oil refining,
atomic energy, and the service sector.
We are steelworkers, standing strong and fighting for what's right.
America's Workforce is sponsored in part by Boyd Watterson Asset Management, LLC. Find out more about our investment solutions tailored to meet the needs of Taft-Hartley funds at boydwatterson.com.
America's Workforce Radio is sponsored in part by the International Union of Painters and Allied Trades, District Council 6, representing painters, glazers, drywall finishers, and sign and display industry workers. They remind you that belonging to a union is your right as an American.
American workers are sick of struggling to get by. It's time to get ahead. In the Teamsters Union, workers are winning industry-leading contracts, historically high wages, fully paid health care, and retirement benefits you can count on. Across the country, Teamsters fight alongside our brothers and sisters to secure a better life. It's what we've been doing and how we've been living for more than a century. When we fight, we win. Join us. Be a Teamster.
Now, back to America's Workforce. Here's Ed Flash Ferens.
And don't forget, you can check us out on at least 5 platforms. That includes YouTube, Apple Podcasts, iHeartRadio, Spotify, and Pandora. And when you get an opportunity, here's what you do. Just sign up and receive our shows on a regular basis and give us a rating. Always appreciate those 5-star ratings, so please keep them coming. Medicare for All sounds good. Medicare, well, I've been on Medicare for a number of years. I love it. My sister loves it. My brother-in-law loves it. So why can't everybody in America have Medicare? Medicare for all. That's what it's all about. There's been a lot of discussion about healthcare, especially since a lot of people no longer have the Affordable Care Act because of the subsidies that disappeared a couple of months ago. We have two distinguished guests joining us on our live line today, both with National Nurses United. Jamie Brown is a president, and Jasmine Ruddy is the director of Medicare for All. Jamie, I want to go to you because I don't know why it's so difficult. There's other countries. We are the most profitable country on the planet. A lot of money in the United States of America. Other countries, Canada to the north, European model. There's Costa Rica, I believe, has like a government run program. And I guess that's even a bad word. We can't have government doing that kind of thing. Or it's like there's models out there that are much better than what we have in the United States. Let's just cut to the chase there. We are spending more when it comes to healthcare, and we're not getting the results we should be getting for the amount that we are spending. Why is that? Is it the insurance companies? What's the problem here that needs to be rectified immediately? What's your opinion on that?
The problem is that healthcare has been priced out of the average person's budget. Other countries, when I describe how I have to go through all the hoops to find the doctor that is covered by my insurance company, they laugh at us because they don't have to jump through the hoops. They go to whatever doctor they want. They see the doctor within a reasonable amount of time. And people always argue, well, Canada, you have to wait so long for an MRI. We can't afford MRIs in the US because our insurance company only covers so much, and you're still paying thousands of dollars out of pocket. It's ridiculous. You might have to wait a month to get an MRI in Canada, but in the US, you just can't afford to make that appointment because whatever you're going to do, it's it's not within your budget. So you just don't get the treatment you need.
I noticed one of the groups that signed on to this letter, and we're talking about a letter that went to over 300 organizations, including a lot of unions. I'll get into some of the unions in a minute. Physicians for a National Health Program. We have featured them on the show. It was a number of years ago. I need to link up with them again. But overall, doctors, you work with doctors every day. Are you hearing a lot of doctors saying, hey, you know what? This system is broken. We got to do something. We got to do something right away.
Yes, doctors agree that the system's broken. Anybody in the medical field that is actually at the bedside working with the patients agree that this system is broken. It's heartbreaking to see the people coming in to my hospital that are just so sick because they can't afford the health care they need. Thousands and thousands of people are dying. And as soon as these $1 trillion cuts take effect, it's going to be even worse. And people aren't going to be able to afford the health care. They can't afford to live. They can't afford gas. They're working themselves to death just to afford basic necessities like food, and they still can't make ends meet.
Yeah, I know a lot of people are cutting back on their medications because they can't afford those as well. I want to talk about the unions. Let's go back to Jasmine Ruddy. Jasmine is the director of Medicare for All for National Nurses United. I'm reading about the UAW, and I remember, the UAW back in the 40s, they were pushing employer-sponsored plans, and there was nothing. There was nothing like that at the time, and I know they're on board. I see the postal workers, IFPTE, they're one of our sponsors. That's a Federation of Professional and Technical Engineers. The flight attendants, CWA, Actors Equity. You got to be pretty happy, Jasmine, that a number of unions, I can only see more unions. Have you heard anything from the AFL-CIO in general right now? I mean, they represent well over 60 unions right now. I would assume they'd be coming on board as well. But it's got to make you feel pretty good that so many organizations have signed on. That's got to send a message in itself, don't you think?
Yeah, absolutely. And we're proud to be in coalition with these unions. Particularly, UE and UAW are active part of the National Coalition for Medicare for All with us, an organization called Labor Campaign for Single Payer that we work closely in coalition with that is really kind of taken on this task of building support, particularly among unions for Medicare for All across the country. But we're proud to be working alongside all of these folks, because I think there's clear and growing understanding among union workers that healthcare is the number one issue at the bargaining table for all of us every single time. It's like the thing that we all have the most kind of agreement on over like any other issue, is that healthcare is the number one issue at the bargaining table, and it prevents workers from spending time bargaining on other things, right? Healthcare costs are continuing to skyrocket year after year. Those costs are continuing to be passed from employers on to workers, and it's unsustainable. And really, we know that passing transformative legislation like Medicare for All would be the biggest victory to the working class in the history of this country. It would separate, healthcare from employment. It would remove healthcare as an issue from the bargaining table, free up workers to spend time bargaining on things like better wages, better working conditions, pensions, even, right? So much is possible with that time saved. But as Jamie, spoke about earlier, it would finally allow the freedom for workers in this country to leave their jobs without fear of losing their healthcare. We hear far too many people who stay at their jobs year after year that they're miserable with because of their healthcare benefits for their families, for their children, right? And separating healthcare from employment. We're one of the only countries that does this, right? That links healthcare to your job. Separating that would provide such freedom for people to leave their jobs, to change careers, to start their own businesses, right? Would make so much possible, and also would give workers, that much more confidence to do things like strike. We know that in recent years, we have seen employers, the UAW has seen this, right? We have seen employers threaten health benefits when workers are on strike. It causes fear when that's, held as a threat to withhold health benefits. Once again, if healthcare is delinked from employment, that leverage that employers have over workers is gone. It would, we think, really unlock an ability for workers to be that much more militant, that much more, confident in their ability to strike. So those are just a few of the reasons that we're proud to be working in. We and all those other unions named on the letter really understand what Medicare for All could do for workers in this country.
Well, let this be a call to action here. I mean, we have a lot of listeners. We're the number one union podcast in America for the last 3 years in a row. There's a lot of people listening right now. They're saying, hey, I like what they're talking about here on America's Workforce. Perhaps they could sign on. Where should they go, Jasmine? To join the campaign. That's what you want them to do, right?
Absolutely. Yes. Like I said before, our website is the easiest place to go to. You can sign up, join our email list if you just want, email updates, or you can, sign up to be part of the Day of Action, or so much more. There's so many activities we're doing all the time. You can get involved in your local community. And that website is medicareforall.org with the number 4, medicareforall.org.
Okay, let me repeat that. Medicareforall.org, and that's the number 4, medicareforall.org. Jamie, I'm going to give you the last word here. We appreciate you coming on the show. I know you got a difficult job. You're trying to keep people safe in the hospitals, and the hospitals are cutting staff each and every day. I talk about it so many times here on America's Workforce. But you got to be pretty excited about this campaign. You've heard about this campaign over the years. It seems this one is a little bit different. I noticed in the letter, the time is now. What do you say to that?
The time is now. The state of the world is ridiculous. Nurses know that Medicare for All is the real solution to guarantee health care. We are excited to continue to lead this fight. We've been fighting for years to move this forward, and the grassroots support we have now is amazing, and it's just the momentum is continuing to build.
It's the beginning of a good thing, I hope. I hope. Well, you have a friend here on America's Workforce. Keep us posted on everything. Once again, those of you listening, MedicareForAll.org. Just put the number 4 in there, MedicareForAll.org. Joining us from National Nurses United, Jamie Brown, who you just heard, one of the 4 presidents of National Nurses United, and Jasmine Ruddy, director of Medicare for All. And that'll be it for yet another edition of America's Workforce. Tomorrow, the New Mexico Building Trades Wellness Coalition. Until then, all of you, have a safe and wonderful day.
That concludes another episode of the America's Workforce Radio Podcast. Thanks for listening, and be sure to subscribe so you never miss a show. America's